Okay, so welcome to the 6 pillars of pre-health. My name is Francesca Pacheco, and if you have any questions, I am more than willing to answer them towards the end. So what are the 6 pillars? Many students on a pre-health track come and visit the Career Development Office looking for internship opportunities. Internships offer students hands-on opportunities to work within their desired field. However, in health professions, finding an internship is uncommon unless it is incorporated as part of the curriculum, just because it can cause student liability issues. So the 6 pillars represent 6 core areas pre-health students can develop in to prepare for professional school. Gaining experiences and developing skills from each pillar will prepare you for your next steps, and you'll be able to stand out amongst other candidates. The first pillar is academics. Academic success is important because each program has a set standard required, whether it's GPA or test scores. Academic success will show your ability to handle new challenges. So for academics, you're going to want to maintain a high GPA. Again, each program that you will be applying for has a set standard and GPA requirement that you want to keep up with. You're going to want to check in with your academic advisor to make sure you are in the right courses and you can map out a 4-year curriculum to see what your next 4 years will look like. Secondly, you're going to want to form effective study habits. The transition from high school to college is definitely different, and the studying will be more rigorous. Next, they also require an entrance exam, so knowing what they're looking for will give you enough time to prepare. As you see, there's a chart included with all the required healthcare exams. The Tutoring and Testing Center on campus also provides mock MCAT sessions. To learn about entrance requirements from each institution, there are different forums online that you can look into that provide interview feedback about specific programs. Student Doctor Network is just one of the many, as you can see the screen grab of the feedback provided on this PowerPoint about NSU. So the website is Student Doctor Network. And you could see they've provided information about Nova Southeastern University. If you click on it, it has the interview feedback, types of questions they asked, school feedback, and what the average MCAT score was. The second pillar is confirming your passion. Confirming your passion early on is important because it will keep you determined throughout your studies. It'll also allow you to gain insight on what you like most about the profession within the healthcare context. How will you be able to articulate your motivation for choosing this career? You will need direct experience on your resume to show how you have confirmed your why. Why healthcare? Why this passion? You can confirm your passion in the following ways, whether it's volunteering at a hospital, shadowing a healthcare professional, or even becoming a medical scribe. There are also multiple benefits to confirming your passion. You'll learn how to work in a fast-paced, urgent setting. You'll get to see how medical professionals interact with each other. You'll get insight into the structure of the hospital setting and how you will fit into it as your career progresses. And you'll be able to ask questions so your work is done correctly and professionally. Confirming your passion is also important because if you have never volunteered at a hospital before or seen the demands or any rough situations that come up, you're going to find yourself overwhelmed when reality hits and you're placed into that setting. The third pillar is research. Research is important considering healthcare is ever-changing and direct clinical experience may not occur until professional school. Research is a key selling point to your ability to stay on top of trends and knowledge necessary in the healthcare field. Doing research in undergrad does not necessarily mean it has to be apples to apples, as long as you're developing foundational skills that you will get comfortable when talking about national trends. Here's an interesting research quote to consider. According to the Association of American Medical Colleges, 77% of medical school applicants reported already having research experience. So how you can find some research opportunities. You can do information interviews with faculty on campus, going to your faculty's office hours and talking to them about open research opportunities, the benefits of research, and expressing your genuine interest in research can help because faculty members are experts within the field. You can also make an appointment with a career advisor who can help you draft an outreach email to send out to faculty. And they can also talk to you about local and national research opportunities. Some of these research opportunities provide housing and stipends. And the fourth pillar is leadership. Leadership is important because as a healthcare professional, you will be a leader within the industry. There are multiple ways to show leadership. You can join an on-campus pre-professional student organization, and these can be found on orgsync.com. There are many organizations from Pre-Veterinarian Club to Health Occupation Students of America. You could find a wide range of organizations. You can also start your own organization. If there's one that's not already on campus, don't be afraid to start your own. You do not have to have a leadership position within any of the organizations in order to gain leadership skills. You can lead an initiative on your own, such as organizing a fundraiser that'll show leadership initiative. You can also develop leadership by being a campus leader, such as an ambassador for admissions, or even a student athlete. The fifth pillar is developing transferable skills. Transferable skills are skills developed in a previous experience, whether it be school, sports, or work, that can be applied in any setting. And on the right, you'll see different types of transferable skills, such as adaptability, leadership, problem solving, detail-oriented, and time management skills. There are many ways to develop transferable skills. You can become a resident assistant on campus. You can apply to be an orientation leader. You can work a customer service job. And you could pursue healthcare-related internships. Developing transferable skills as a pre-health student is necessary because as a healthcare professional, you will need to be a problem solver. Similarly, if you were a resident assistant on campus, you probably have utilized your problem-solving skills, which you will need when working with patients in a healthcare setting. And finally, the sixth and last pillar is community involvement. Community involvement is important when entering the healthcare field because that means joining an industry that is focused on serving others. Being involved in community initiatives showcases how your values align with that of the industry. Values such as giving back to the community and helping underrepresented populations are gained when you have community involvement. You also gain an appreciation and knowledge of cultural diversity. And here are some different ways to be involved within the community. So you could visit the Student Leadership and Civic Engagement Office on campus, also known as the SLICE office. Service and leadership go hand in hand when students get involved on campus. Service provides students with an opportunity to expand outside of their comfort zone, learn more about the community at large, and get to know other like-minded students with similar passions. You can also volunteer with Hands on Broward. Volunteers create art in public spaces, build sustainable gardens, teach financial literacy, respond to disasters, and work to protect the environment. Or you can also volunteer for the Special Olympics. The Special Olympics has documented the effects of volunteering on healthcare professionals who work with the Healthy Athletes Initiative. Volunteering positively changes healthcare practices, increases intent around educational pursuits regarding the health issues and health management of people with intellectual disabilities, and positively alters perceptions about the abilities and decision-making capabilities of people with intellectual disabilities among healthcare professionals. These 3 ways are just some ways to be involved within the community. There are many more options. And finally, here is an overview of the 6 pillars. We have academics, confirming your passion, research, leadership, transferable skills, and community involvement. So you must self-evaluate where you stand on each pillar so you know the areas that need to be developed. Just like any stable structure, if one of the areas lack, it could collapse. Are there any questions at this time? If you have any more questions or would like to talk to a career advisor regarding the 6 pillars of pre-health and different ways you could get involved on campus, here is the contact info. You could call the front desk or email.